The state of Maine will create its own insurance marketplace. Maine's Governor Mills has notified the Centers for Medicare and Medicaid Services, or CMS, that it wants to create its own state-based Affordable Care Act insurance marketplace. It said it wants more control of its insurance marketplace. And here are a couple quotes coming out of the governor's office. By pursuing a state-based marketplace, we will be putting ourselves and not the federal government in the driver's seat, which then, as the quote continues, will better insulate the state from some of the attacks on healthcare coming out of Washington. So here's what's next for the state of Maine, a little bit of a timeline. They need state legislation and federal approval to make this work. They will need to introduce legislation in January 2020 to authorize this state-based marketplace. They will then take over marketplace outreach, marketing, and consumer assistance functions by the year 2021, with the goal of being a fully state-run marketplace by the year 2022. Now, just to back up a little bit, this is the state where the people of Maine voted for Medicaid expansion back under the previous administration, and that was blocked by then Governor LePage. It was a ballot measure. The people spoke. They wanted Medicaid expansion. They wanted enhancements of the Affordable Care Act implemented in their state, and that would never happen. In fact, Governor LePage vetoed Medicaid expansion 7 times throughout his 2 terms in office. Governor Janet Mills was then elected, and she changed the tone a little bit of the governor's office, saying on day 1, she issued an executive order saying, we're moving forward with Medicaid expansion. We want to cover up to an additional 70,000 people. And now she's continuing by saying, and we want to run our Affordable Care marketplace ourselves. So for these first years out, they will still use healthcare.gov for insurance signups. They will use the same providers who currently offer plans. They expect to see some federal money coming in to help with the education and outreach activities. And there are about 71,000 people in Maine that have an Affordable Care Act plan now. They expect that to stay the same and maybe even grow once the state administers the plan in the future. Has this been done before? Yes. Maine is the 6th state to step toward changing into a state-based marketplace. 12 states have fully state-run marketplaces, and until Maine actually implements this, 5 of them use healthcare.gov but administer it with outreach and education at the state level. Maine will be the 6th to do that. If you want to read more about this model of switching to a state-based insurance marketplace as allowed for under the Affordable Care Act, we list to an article below that gives you a little bit more detail in that description. If you like this video, hit the like button and subscribe to stay up to date on other updates on what other states are doing with Medicaid and private insurance.